Hi guys, how are you doing? Today I am coming to talk to you about the difference between a migraine and a headache. They both affect the head, but they are different in intensity. Headaches are not so intense. They last a day or less. Migraines will take a day up to a week. For some people, the people who get really severe migraines, they take a little longer. The signs and symptoms of both the headache and migraines are different. The way we differentiate a migraine from a headache, migraine is differentiated by the acronym POUND. P is for pulsating pain. It's dinging, it keeps dinging. You take medication and it's just dinging and dinging and dinging. And then it's on one side of the head. It's never both sides. It's on one side of the head. They get nausea and vomiting. Debilitating pain is the biggest symptom. Intensity, debilitating pain / intensity. The intense of a migraine is much more severe than a headache. And then these people are sensitive to light. The light bothers them, it intensifies the headaches. So most of the time they'll try and sleep so that they don't get the headache as much, because with the eyes closed, then they don't see the light, and that kind of decreases the migraine a little bit. With headaches, most people will take an over-the-counter medication and it will help the headache. Usually in 1 to 2 days, a headache is gone away. Migraine, not so much. Not so fast. It has all those 5 symptoms I mentioned. And besides that, its duration is longer than a headache. So we do have causes. Some people do get causes when they're in touch with certain things. It strikes the migraine and they start having a migraine. But I'm going to differentiate the causes for the regular headache and the causes for the migraine. Though some of them are interchangeable, like hormonal changes. You can get a migraine with hormonal changes, but you can also get a headache with hormonal changes. But so let's start with migraine triggers. People who have migraines will explain to you really well, because they've learned the headache, they've kept a headache diary, they know exactly what causes their migraine to start. So mainly alcohol for some people will trigger a migraine. Caffeine for some people will trigger a migraine. Genetics, some people get migraines because genetically somebody in their family had them, so they do get them. Hormonal and weather changes, those will affect both either headache or migraine, but it affects, we're talking about migraines now, so it's under the migraine category at this time. Lack of sleep will affect both. It will affect both a migraine and it will affect both a headache. Light and sound. Some people, the noise when they have a migraine causes the headache to intensify. And then stress can affect both the headache and both the migraine. And now let's go to headache causes. Triggers is what they call them. So lack of sleep will cause you a headache. I do get headaches when I don't sleep 8 hours. I do get, and it's on one side, it's ding, 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 ding. But it goes away. It's not like a migraine, doesn't last long. I usually know the cause is I haven't slept well. So that is your headache trigger. Another trigger is alcohol. That will cause a headache for some people. Another trigger is being hungry. Some people, the hunger will cause them to have a headache. Poor posture for some people will cause them to have a headache. Strained neck. Most people have this neck pain that causes headache, but it comes from the neck all this way. What we call that is a tension headache. Usually the neck muscles are tense, and so they cause you to have a headache. So for some people that is. Stress is bilateral. It does cause a migraine, but it can also cause a headache. So those are the main causes. Stress and hormonal changes are interchangeable for migraine, and stress, hormonal changes, and lack of sleep is for both migraines and headache. So those are the main triggers that most people get. Now, let's go to types of headaches. We're talking about migraines, but there are types of headaches that I would want you guys to know about. We have tension headaches, the ones I talked about, usually starts on the back of the neck and goes into the head. That's a tension headache. Some people will tell you, you know what, I feel like I have tension in my neck, but it's causing them to have a headache. So that's a tension headache. Another headache that people usually get is sinus headache. When you have cold symptoms, congestion, they have headache right here. It's from the sinus congestion, because you have sinuses here. You have sinuses in 6 places. These are one of the sinuses. This is one of them. This is another one. So the congestion will be right here and the headache will be right there, and it's because of congestion. Some people will use a neti pot, and this will clear off the congestion and help ease the headache. But those headaches are also very severe, so it's good to get rid of the congestion to help the headache decrease at that point. Another headache we get is cluster headache. And what cluster headache means, it comes in clusters. So you get it, and then in 30 minutes it comes again, and then in 30 minutes, the timing is different. It can be 30 minutes, it can be 2 hours, but it comes in clusters. That's another headache that's so severe. Mainly it occurs in men, but it can occur on everybody. They are usually a result of dilation of blood vessels of the brain due to release of serotonin and histamines. But they are also severe headaches and can cause you to be severely uncomfortable. Those are cluster headaches. They can be caused by physical exertion, they can be caused by bright lights or altitude changes. In some people who travel to high altitude places, they do get those cluster headaches. So those are the main types of headaches. Tension headache starts on the neck or upper shoulders, runs into the head. You'll find the person saying, my head is aching, but they have tense muscles. That's a tension headache. Then you have the sinus headache that comes due to congestion. Severe congestion. Usually when you have a cold or something, you won't get it if you're just dry or you don't have a cold or something. It's congestion and the sinuses are congested, so then they cause a throbbing headache. And then you do get cluster headaches that are rare, affect men more than they affect women, but anybody can get them. Those are the main types of headaches. Let's talk about migraines. Migraines and how some people can tell a migraine is coming on. Most people who have a history of migraines can be able to tell when a migraine is about to come on. And that in healthcare is what we call the prodromal stage, pre-headache phase in layman's terms, where you don't have the headache yet, but you're starting to get signs and symptoms that it's about to come on, hours or days before the actual migraine actually occurs. It includes mood swings, food cravings, but you're able to tell the migraine is coming on. If you do see a headache specialist, sometimes they give you medication and you can take the medication and the headache can go away. But for those people who don't know, usually the migraine just comes on full blown. But most people who have a history of migraines, they're really able to tell you that I can feel like the migraine is coming on, and they can take their medication. They have medications that they give them to take an hour or two before the headache starts. And that the reason is these people know their migraines so well, and they can tell when a migraine is about to come on. So that's the preventative measure that you can take, is take a medication prior to the time occurring. Another phase is the aura phase that they have. It refers to sensory disturbances that occur before or during a migraine. That's their aura phase. It can affect somebody's vision. You find like you can't see well, touch or speech. Not everybody suffers from this. Some people just get a full-blown migraine, no prodrome stage, no aura stage, and they just get into a migraine. But most people who have a history of migraines have the aura phase, the pre-migraine phase, where they can tell the headache is coming. Examples of auras include blind spots, blurred vision, your vision starts getting bothered, numbness in one arm, jumbled speech. That is the aura phase. These are migraine people who've had migraines for a long time. They have studied the migraines and they know when a migraine is about to come on. Headache phase is when the pain usually hits. You've gone through the pre-headache, you've gone through the aura phase, and now the headache is actually here and it hits you. It may range from mild to debilitating. Of course, if it's a migraine, it eventually becomes debilitating. Physical activity makes the headache intensify. Lights will make the headache intensify. For some people, smell will make the headache intensify. But some people will have a migraine without developing a headache. Some people can actually have a migraine without developing a headache. And then you have the prodromal stage. This is the final stage when the pain has subsided. People will feel exhausted, confused, fatigue, severe fatigue. They have severe fatigue from the headache because the headache takes a lot from you. It takes a lot from you. So Those are the main phases for a migraine headache. What causes migraine? Most people ask, what causes migraine? It's different for other people, as I had said. Some people it's genetics, some people it's gender, hormonal shifts. Women are more likely to suffer from migraines in comparison to men. Menstrual cycles will affect some people, and because of the hormonal changes cause you to have a migraine. But women are more apt to have migraines more than men are, just like men are more able to get cluster headaches than women are able to get cluster headaches. Allergies for some people is a trigger for some people it will cause you to have a headache. Allergic rhinitis, so for some people that is a trigger, it will start the headache on. Family history or genetics is another trigger. Some people genetically they've just had headaches or migraines and they're born into it, so they continue. They usually see somebody for it and they're given the medications. There's medications that they can give you for pre-headache that you can take that will help decrease the typical length of a migraine or the typical intensity of a migraine, because migraines are quite they are quite intense, cause severe pain, and some people can't even go to work because of it. Another thing for some people is environment. Triggers like stress, food, smells, or lack of sleep that can cause trigger for migraine. So that's another cause of migraines. They do have lots of medications. Usually you'll see a doctor. They'll require, if you're just getting a migraine, if you are pro at migraines, you know how to keep a headache diary. You've gone to your doctor and they'll give you medications that you carry around and are able to have medications around. So when you feel it coming on, which is the pre-headache stage, then you can take the medication and hopefully you can abort the headache with these medications. But some people will actually have to stay at home because the headache is so severe. So those are the main difference. The best way to treat headaches and migraines: avoiding the triggers, avoid stress, get a full night's sleep. This will decrease the severity or the frequency of both migraines and headaches. That's an important preventative step which we can all take instead of taking the medication. Back and neck strengthening, reduce stress are effective ways to prevent tension headaches, because tension headaches come from mainly shoulder and back of your neck. That's where they go, and then they go to the head. So most of them will complain of the lower head having pain. It's coming from the shoulders, it's coming from the neck. So strengthen those muscles, stretch a little bit so you don't get them. Meditation, acupuncture. Some people treat their headaches with acupuncture, which is really good because it takes away the headaches. Dietary changes. If you're those people who get headaches or migraines because you ate something that didn't agree with you, or you ate something that is a trigger for you, then changing the diet, because now you're keeping a headache diary and I ate this and this is what caused the headache or the migraine, then you can avoid that stuff and that will decrease the intensity of your migraines/headaches for those who get headaches because of food, and for those who get migraines because of food triggers. That can do that. There are many treatment options. Follow up with your doctor. Some people get Botox. This helps. They get Botox and 4-6 months they haven't had a migraine. So that's the new treatment on the block. The other one is getting the medications from your doctor. These are migraine medications, because sometimes the Excedrin, the Tylenol, the ibuprofen doesn't cut it, especially if it's a migraine. So if you have those migraines where Tylenol, ibuprofen, Excedrin doesn't cut it, then your doctor will give you the heavy guns like the Fioricet, those that you take, sumatriptan, the ones that you take prior to the headache coming on, or when the headache has taken, you take it, and in 2 hours you can take another one. That one you have to see your doctor, arrange with him, and they can look through those and start you on those medications. For those who have severe headaches, Botox is an option. Botox has worked for many people. That is an option that you can take. There are many effective ways. In most severe attacks, prescription medication will do the trick. It's the best way to stop the migraines. Unless you get a prodrome, the pre-headache, then you can avoid it and take the medication. you know. Some people, the headaches are so severe that they have to follow up with a neurologist. If you follow up with a neurologist, follow up with your appointments. That way they follow. They'll ask you for, as I had said previously, for a migraine diary. Give it to them so that they can follow up and see what causes these headaches, what time is it, how often do they come, how long do they last, and then they'll get a treatment plan for you. When should you be worried about a headache or a migraine? The severe headache that does not go away. Those ones can cause seizures. So it's important that you really, really follow up with headache. If it is a headache that you take Tylenol and you're okay, that's okay. But a headache that changes your mentation, the intensity does not decrease despite medications, fever, stiff neck, or you say it's the worst headache of your life, those ones you have to follow up, because some of them can cause seizures. So there are regular headaches, you take medication and you're fine. Migraines, you take medication and you're fine. But if you're saying you've done all that and you feel like this is the worst headache of your life, that is emergency room. You have to go to the emergency room. So basically, that's the difference between migraines and headaches. You guys have a great week and we hope to see you soon. Bye-bye.